Ja, wij voeren hier ook operaties uit. Eigenlijk de meeste verwondingen die we binnenkrijgen betreffen de ogen of de flippers. En ja, soms moeten we helaas een flipper een teenamputatie doen, omdat er bijvoorbeeld infecties in het bot zijn toegetreden. Ogen kunnen met grote verwondingen binnenkomen. Dus daar worden ze aan geopereerd.
At the moment we are in the surgery room and we have quite new equipment because we had a fundraising a few years ago. We have a new very nice table that is made for us especially. And here we have the anesthesia machine. With this machine we can put seals under anesthesia. We can bring a tube inside their throat and keep them under anesthesia with a special anesthetic gas that comes from here. And with this screen we can have all kind of sensors connected to the seal to know how the seal is doing while it's under anesthesia. In the new place, yeah, everything is going to be a bit bigger, but also newer. So yeah, we are really looking forward to doing operations there. But we also will have, next to the surgery room, we will have an X-ray room. So when we are taking X-rays during surgery, for example, we can do it in that room.
So Lophi is a gray seal pup that was brought to our center because it was already noticed that he had a damaged eye, that there was pus pouring out, and after further investigation we were sure that he would never get vision back in that eye. So we thought that the safest and best solution was to remove the eye. To be able to do an operation like this, of course, you need the animal to be under anesthesia and to also control the pain because it can be quite painful. Seals are wild animals, which means that the anesthesia can be a bit more complicated than in humans, cats or dogs. With seals, the very big challenge is that they are animals that dive and have a diving reflex, which means that when they are under anesthesia, they will stop breathing. So that's why we have to intubate them and breathe for them. We monitor the seals very carefully during anesthesia, so we constantly check that the heart rate is okay, that they have enough oxygen in their blood. We keep checking the temperature, and towards the end what we try to do is to slowly remove the anesthetic so that the seal can start waking up while we're still finishing the last part of the surgery. This is because seals take a long time to wake up from surgeries. That's because they have a lot of fat, a lot of blubber. The biggest danger during anesthesia is for sure that the seal might have an anesthetic plane that is too deep. It can happen sometimes that seals don't wake up from anesthesia. And then for the surgery itself, it can be, yes, the infection. When the eye opens, there can be some pus contamination that goes to the blood flow and then can cause infections in the body of the seal. Lophi in particular is with antibiotics right now, so we hope that we are preventing the spread of the infection like this.
Wij worden geholpen met name door medische artsen uit het Medisch Centrum Leeuwarden of door dierenartsen uit de buurt die ons vaker geholpen hebben. Ze helpen ons hierbij vrijblijvend. Het is voor hun weer iets anders wat ze op de operatietafel krijgen. En voor ons scheelt dat enorm veel in de kosten natuurlijk, dat wij op die manier geholpen worden door ze.
The surgery went quite smoothly. It took us a little bit longer to get the seal to sleep because it looked very sleepy at the beginning than not was waking up. But once the seal was under anesthesia, everything went very smoothly. The oxygen in the blood was really good throughout the whole anesthesia. The biggest problem we had was that the temperature tended to be a little bit low, so that's why we had to warm up the seal as much as possible by giving hot water bottles. It bled quite a lot, which is normal in these kinds of surgery when we remove eyes, but it was okay. They recover very fast. It's mostly making sure that the surgery wound stays closed, that there's no secondary infection to it. We will keep her not swimming for a whole week, and then slowly we will let her have access to the pool again. We have released many seals with only one eye. We don't have news of them not being able to survive in the wild. Of course, we cannot monitor it completely, but seals compensate very well with the whiskers that they have. Actually, they use mostly the whiskers to hunt underwater. However, we do not take the responsibility to release seals without both eyes, because of course we don't know how they can adapt in the wild, but with one eye, as far as we know, it always went really well.